Hello there. I wanted to share some thoughts of mine that aren't directly related to the figures, but appear on Twitter and other places for people that don't get access to that. I want to just run through really some good news and bad news for the week. Now, let's start with the bad news. Cases are increasing rapidly, and we've been seeing this for about the last 3 weeks now. And this trend, if it continues, is going to be bad news. And so we're certainly back to where we were in June. Previously, there was no hospital activity, but now we're starting to see that pick up. So we have to take this seriously. It will cause extra deaths and other problems. It isn't just the young. According to our data, really that the age hasn't really shifted that much. So we can't just say it's nothing to do with us. I realised that many of you had on the app have tried to get some tests and have found it very difficult. We do know about the problem. We have told the Department of Health, and we are trying to resolve it, and we think that things should improve in a week or two, so do just bear with us. Always best to try and phone or email them at beginning or end of the day, 8 o'clock, 5 o'clock, that seems to work best. So bear with us, do keep trying, it's really important. And also the other thing is that, the other bad news is that we realise that children do get affected. It's usually very mild, and they often have different symptoms to those that adults get. So do be aware of that. They don't just look for the chest symptoms, which they really don't get. They get pretty much everything else and often get gastro symptoms. So bear that in mind. Now, there is some good news. That is that cases look as if they're possibly getting milder. There's some suggestion of that, less severity of the symptoms, and it could be that this is because there's less dose of the virus being passed around because we're using masks more, we're distancing, and so less of it is being transferred from one person to another. Let's hope so, because that's great news if that's true. The other bit of good news is that so far the reinfection rate has been incredibly small. There are a few cases of people getting infected twice, but when you look at the 20, 30 million people in Europe affected, this is really tiny. And that's after 6 months, so that's good news. And this might explain why we haven't seen the big surge in extra cases in places like London, and also in healthcare workers who bore the brunt of the first wave of infection. So there might be some temporary protection for those people, or if they do get it, it might be milder. Let's hope so. And more people are logging than ever before, and that's been, I think, as we've seen the spike in cases, interest has come back again, and understandably people now want to look after their community, work out what's going on. More people are now logging for their children, and this is really important as we try to integrate schools into our program. So I think there's good news and bad news, but definite reason for optimism, and more people that log, the safer we'll all be. Thanks.